Okay, I brought this with me because I thought it is a good teaching tool. It's job description for a global medical affairs leader in infectious diseases. And lots of you would qualify for that job. Yeah, lots of you would. So Johnson & Johnson Pharmaceutical Services. So obviously this is not a public job, this is a private job. So you having some experience with private industry would really, and preferentially maybe with the pharmaceutical industry, would actually be of benefit to you. I'm trying to go with you through this job description so that you know how to read what they want to see in your application letter and in your CV. Yeah. So they're looking. You would be in New Jersey. Yeah. You would not be in your preferred country, even if they look for infectious diseases. Here they say it's a legal cooperation entity encompassed in a unique group of 5 businesses. So guess what? If you apply for that job, you look up Johnson & Johnson and look up what the 5 business units are that they are representing. So do your homework. The more you understand what you're applying for, the better are your chances to get actually selected. Yeah? Because in the interview, if you get selected for the interview, they will say, okay, we're made out of 5 businesses, and you can say in your application, yeah, I've made myself familiar and I know 3 of them quite well from the situation I'm working in at the university, in a clinic, whatever it is that you're doing. So you're showing them, yes, I have interest in this, and yes, I have understanding that there's complexity involved. Yeah? And they would expect you to also reflect, how do you deal with complexity? How do you deal with large teams? How do you deal with strategic directions? Because if it's 5 different businesses, guess what? You have to figure out what the strategic direction is that the company is still moving forward, yeah, in the infectious disease branch. That's all what you can learn from this first paragraph. And here they actually list all of this. Yeah? So global health economics and pricing, pharmaceutical group business development, a pharmaceutical procurement group, strategic marketing, and communications. So you find this communications everywhere. Yeah? In all of these areas, you should have some idea of how did your background help you to be relevant in all of these 5 areas. That's your first paragraph of what has been written here. So then, this person is responsible for leading the clinical commercial optimization of product development. So your clinical background is highly relevant. The question is, how much have you actually taken anything to market? Or how have you contributed to products that have gone to market? Product development and life cycle management strategies. If you don't know what this is, you better Google it and understand what life cycle management is. Yeah. And so he or she will lead this global medical affairs team. Look on the website and see how big this team is. This is a team of 20 or is this a team of 2,000? Yeah. So always also make sure that once you agree to send in your application, are you up for the job, or are you looking out of your league? Yeah. Don't apply for something when you are too junior, because you will not look competitive in the market. Yeah? So do a thorough self-assessment and say, would I want to lead such a large group. Yeah. And many jobs are not that big. This was just something that I came randomly across, and I thought it's a good example to understand how these things are structured. Because many job advertisements are structured the same way. So, and then here is what you would actually be doing. Yeah. The Global Medical Affairs team, so that means there is many, most likely physicians in this affairs team, and partner closely with regional medical product leaders. Yeah? So more doctors involved. Yeah? The Gmail will be an integral member of the compound development team and the global commercial team. So you know already you are part of 3 different teams. So most of your days will be spent in meetings to learn about what other groups do, so that you can translate it forward into the large randomized controlled trials that Johnson & Johnson is most likely interested to move the compound from development to the market. Yeah. So if they say we need 6,000 participants, 3,000 get the drug, 3,000 don't, how would you roll this out in 10 countries? To facilitate quickly, let's say in a year, and they give you a year to recruit this. Yeah. So how would you recruit 600 participants in every site? What structures have to be in place that you can establish that kind of structure? And what type of communication, HR background, optimization of enrollment has to happen, so that at the end you can say, here are your participants, here's your data to the company. In addition, this person will be accountable for global publication plans. So what types of writers do you need? What types of publications have they done in the past? Yeah. What's their publication pattern? Are they always in JAMA? Are they always in a high-ranked journal? How fast of a turnaround can you offer? So they will most likely ask you, what is your average turnaround between completion of the data and your first publication? So they want to see this, yeah? That you can plan for that type of turnaround. And then, of course, you will be a global opinion leader. You will be accountable for the global publication plan, the global opinion leader relations. Yeah? So how do you, as Johnson & Johnson's medical infectious disease officer, reach out to the people where you think they are really the leaders in HIV, TB, malaria, any of the areas that Johnson & Johnson is interested in, that you know the 10 most famous people in the field. And so social media, going to conferences, introducing yourself, being at the places where, being at the fora, at the professional fora where decisions are made, being part of one of the special interest panels that works on things. That's where I think your community engagement should be spent. Because then you're building your scale and you're building your impact. Yeah? So that people know you. They don't know you from teaching 200 students here at Makerere. They know you from the professional organizations where you raise your voice, where you stand up and say, I'm such and such from Makerere University, and could you please make a statement to this or that? You identified yourself as a professional, you identified your professional institution, and you just made a contribution to your field by asking that question, because maybe 20 people in the room have the same concern. Yeah? So this is a way where communication becomes a real tool for you to become better known. It's not only that you solve problems within the college or within the university, it is really that you be part of the world community of scientists and make contributions. So speaker training, obviously they expect some form of training activities that you oversee. Most likely not you do, but that you have staff that will be doing speaker trainings with the 5 groups. So if any of these groups needs speaker training, that you have staff on hand that will help them to get this prepared well. Yeah. Where are we? Global advisory boards for products starting in early development through the launch of major life cycle management initiatives. And then you will be also responsible for facilitating, ensuring a consistent approach to medical affairs programs and activities globally. Can you follow rules and regulations? Do you understand global rules and regulations? Yeah. So having a background, for example, in the university rules and regulations, because you were in the faculty senate, that really helps to build an insight how policies work, how they get developed, how they get implemented. And you can say, yes, I've been for many years on the policy committee of Makerere University, and here are the outcomes that I managed or that I contributed, or the policy briefs that I wrote. So there's lots more that this poor person is responsible. It needs to be a very experienced person. So here you come now, an MD is required with specialty training. So this could be a gynecologist, it could be a psychiatrist, this could be an oncologist, it doesn't matter, but they clearly say, we don't want a newcomer, we want somebody who's specialized in an area and has gone through the extensive training to a specialization. A certification in infectious disease is preferred. Yeah? So having some form of infectious disease training would of course be preferential if you're responsible for infectious diseases, of which there's 400. Yeah. Do they expect you to be an expert in 400? No. Yeah. And it says it's preferred. And if you would take a candidate from Africa where half of the cases every day has some form of an infectious disease, you could easily make the case, I'm specialized in women's health, but a quarter of my population is HIV infected, has problems with malaria, has issues with schistosomiasis, and just give them some example of where your day-to-day scope is. Yeah? Extensive clinical and or pharmaceutical experience, so they actually might even consider a pharmacist with extensive experience in infectious diseases. But because the person has to lead so many medical teams, it will most likely be of essence that they speak colleague to colleague. So the pharmacist will most likely die on that hill. While they may have more experience in the pharmaceutical experience, they will not have the clinical experience, and if they want these big trials to roll out, usually physicians only listen to physicians. Yeah, that's just the way it is. Vaccine experience is preferred, so anybody who's done anything with vaccines will fare better or will raise higher in the pile. Yeah. So you always have to think how high on a scale of 0 to 10 will my application land. Yeah. So the more check marks you can make behind these, and a public health background is also preferred. Yeah? So all of your additional trainings have not been in vain. 10 years of experience in medical clinical environment and scientific function or scientific function in the pharmaceutical industry is required. Yeah. So that eliminates out of the 500, maybe 300. Yeah. Brings it down. Yeah. The recruiters really want 6 to 10. Yeah. That's what they're looking for. 6 to 10 viable candidates that stand an interview, a first go-around interview. Yeah. At least 5 years in medical affairs, demonstrated a track record of leading highly matrixed cross-functional work with teams comprised of high-level managers and executives required. So, are you a department chair? Are you the dean of a college? All of that would bring you to the level where you would actually be a suitable candidate, because now you're not only leading downwards, you're also leading upwards, yeah, to the university. And then this is global mindset and direct experience in multiple markets, proven abilities to partner cross-culturally, regionally is required. So many of you have been in the US, in Europe, in India, in other countries. So those experiences will be invaluable because you have a broader view to represent different markets that you've experienced yourself. Yeah, and that's really highly important that you value that on your CV, and that you sell this in your CV when things like that come forward. Must be highly innovative. What makes you innovative? I asked you in your elevator speech, what's your niche market? This is what I mean. What makes you highly innovative? How have you contributed something significantly that made a difference? Yeah. And then a spokesperson. So how easy is it for you to stand in front of a large crowd of 500, or your shareholder meetings will most likely be 50,000 people? 20,000 people that you give a talk to. So how do you manage yourself on that stage? Because those are your shareholders. Those are the owners of the company, yeah, when they come together. So they expect you to answer their questions. And guess what? You don't get 20,000, but you get at least 3 high-level questions from the audience that day. So you better be really prepared in thinking of what could they ask me that I cannot address in my talk. That could be of interest to them and of value to them. Again, what value do you bring to them? It's not what value they bring to you. Yeah. You have to still always think, what value bring I to this crowd? Yeah. And guess what's the last sentence? Excellent communication skills required. Yeah. This is of any high-level leadership position, this is the last thing that they will say. How easily can you capture a crowd? How easily is it for you to communicate change? How easily is it for you to be able to address difficult situations? So all of the things that we've gone through the last 3 days, I hope give you a sense and an understanding of how you can communicate better, more effective, and get better outcomes. Yeah. I would like from each of you a brief comment. What was important today? What did you learn new? What was significant?